Lean thinking can be applied to any process, no matter what field you work in. Whether it's business, manufacturing, government, or healthcare, Lean provides a systematic approach to eliminate wasted time and effort. The following video demonstrates how the Northeastern North Carolina Partnership for Public Health, with help from NC State, used Lean to improve work processes and patient care. County healthcare professionals talk about their success in their own words.
Everyone would say, well, they don't know anything about home care or taking care of home care patients. And we quickly realized, and I would reassure staff, that it doesn't matter the task you're doing. It doesn't matter if we're making Band-Aids or taking care of patients. Lean can be applied in any situation, in any setting. And it just matters that they come in and look at your process. They don't have to know how to do your process. They're just looking to come in and examine your process and help you make it more efficient. And the staff very quickly realized that and bought into it.
It was empowering and it was spreading, and I think that's the idea of Lean, is you make it a culture. And it's not a one-time thing. Your staff all of a sudden looks at things differently and continuously looks at things to improve. And it's the tools, that are taught in Lean. I think one thing that was really important was that they came to us in our setting. And when we went through, we looked at the process in our own setting, and then they taught us how to look at it and find the wasteful areas and then work on them.
And the Lean process is simple enough. I know it can be complicated up, I understand that, but it's simple, basic, just do it right the first time, but cut waste, that I think anybody can understand how to do it, and it's not so hard to facilitate.
A lot of it's just common sense, but it just kind of gives you a different perspective of the way it looking at something. And you put a few people, different people together with different ideas, and you can really brainstorm something and just really revitalize a whole workplace. I think everybody came out with a really positive attitude. There's some people that aren't that don't welcome change that much, but even those people came away with a positive attitude. Initially, I didn't know what to expect, but I found each day as I went through, everything that I started to look at in my work life and my home life, there's always a better, more efficient way to do everything. And it's helped me at home as well as at work be much more efficient.
I was skeptical to begin with, and ultimately we learned, hopefully all of us learned, that it's going to take the whole team to make it work.
I mean, I think the same thing. I didn't know what it was going to, I didn't really know what we were fixing. I mean, you don't really know how broke you are as a system until you start breaking it down and looking at it, and then you're like, oh my gosh. But now we run much more smoothly than we did before.
I was not on the team, but I came in at the end of every day, and they reported to me what they had accomplished. When I walked into the room, I felt the energy. I couldn't believe it. They were on top of the world. They were owning everything they were doing, and that was such a morale boost for that group of people, and that ownership has continued throughout those team members for this particular project. And I was a little frustrated because at the end of it I thought, now I've had all these meetings, we've had all these committees that I've been a part of and I've led. Never could I achieve that. So I wanted to be a part of that immediately, and I wanted it to continue throughout our agency and have more and more staff members exposed to it.
So the big picture and bottom line is, when we did do the Lean program, it did a lot of things. It was win-win for everybody. It was win for the client. They didn't have to wait as long. They had more opportunity. We were able to schedule different. We can see a lot more clients than we did before. The staff got, once the first day was over and they understood their role, they were empowered and they were so enthusiastic. And then when they were going around doing their things and looking, the other staff that weren't even on the team, they were all excited and, oh, we want to, when can we do our area? When can we do maternity? When I told my managers, and the staff, I said, you just need to take a leap of faith, because at first you're not going to understand anything about it. but it's got to be a win-win.
Well, ultimately, clients benefit, but they do that as a result of staff benefiting from better utilization of their time. It's a systematic approach. We have a small staff, but we offer all the services that a much larger health department would offer, which means we all must multitask.
The morale is just amazingly increased because people feel better because they're not wasting time. You know, when they come back at the end of the day, they've seen their patients, they have time to follow up on the phone with the doctors, they have time to do their paperwork and that kind of thing. So it really was a very positive experience for our agency. And they are pleased, their outlook is good. We had the right people around the table for this lean event. It has been a great, great process.
In this room is the supplies that the nurses use daily on their visits to see their patients. They come in, they can look at the list that's here on the end of these shelves and find what they need more easily. They're also color-coded to match what is on the shelf. We also updated our supply list to make it easier and quicker for the nurses also.
What the morning shuffle is basically making sure that all the nurses have their schedules and are getting out seeing patients. Before the Lean project, it took about anywhere from an hour and a half to 2 hours to complete that process. So a nurse was sitting around from 8 o'clock until 10 o'clock in the morning, waiting on her assignment, waiting to get out to see patients. Wasted downtime. This is the assignment board, and what we've done is we put the nurses' names, and what I do in the morning when I come in is I verify their schedules, and I put the schedules in their slot, and all they have to do is walk by my door, grab the schedule, and they're gone. And they can get their assignment and get out and see their patients.
Another area that we were able to streamline with Lean is our registration process. We actually set through all the forms that were given to our clients and tried to walk through them ourselves, and we noticed that the clients were given an awful lot of information, a lot of paperwork. So we took our HIPAA privacy and we were able to condense that from about 6 to 7 pages to a front and back page brochure, which is a lot easier to give to the clients. We found that clients are actually looking at them now, and it reduced extra copies and papers that we were having to provide to the client.
But we chose to do home health billing. Found out that the average amount of time it took from the admission of a client to the first billing piece was as long as, oh gosh, I think it was almost 40 days, but the average was running 25 days. But we were able to get that time down to an average of, we've been as low as 12. I don't know if it's a direct result of the process improvement or a direct result of the two clerical team and the nursing or clinical team coming together around the table to understand what each does and what each needs. That improved, I know that improved the team abilities to work together too. But whatever, the income has increased.
For one thing, we're more productive. Just the morning shuffle process. Our nurses have their schedules, they're up and at them and seeing patients more quickly, therefore they can do more visits in a day. Patty's productivity lean project, she's piloting a couple of things with 2 nurses. They're more productive. So if you think about that, that means financially we're not having to pay part-time nurses to come in for those visits that our full-time nurses are now doing. And if we are able to continue with those kinds of activities, then financially it's going to certainly be a help. It'll make us more cost-effective.
If you are interested in how NC State can help improve your organization, please visit us at www.ies.ncsu.edu.